Good morning to everybody. In the hospital, the materials what we are using should be clean and sterile. Like that, the syringe bins what we are using also should be sterile. So I would like to demonstrate the procedure of sterilization of glass syringes today. You see, sterilization means complete destruction of microorganisms. Yes, material is said to be sterile when it is completely free from all microorganisms. The syringe bin we will be sterilizing by autoclaving. Autoclaving is the process of complete destruction of microorganisms and its spores by moist heat. Now let us see the articles what we are using for sterilization of glass syringes. One pair of gloves, one syringe bin with its stand, glass syringes, needles, one basin with the hypochlorite solution, one basin with the hydrogen peroxide solution, one basin with the soap solution, one running water source, one small bottle brush, one clean towel. Let us see the procedure how we are doing this gas sterilization of glass syringes. First, wear the gloves to protect our hands from contamination, because the syringes what we are receiving from the ward, it won't be sterile, it will be just washed and brought. Receive syringe from the syringe and the ward. Check the syringe bin, any breakage, shortage, any damage to the syringe. If there is anything, we have to get the signature in the prescribed form from the sister in charge. Put all the syringes into the hypochlorite solution. This has to keep for 10 minutes. After 10 minutes, take all these syringes, put into the hydrogen peroxide solution to remove the blood stain. This also has to keep for 10 minutes. After 10 minutes, take all the syringes, put into the soap solution for 10 minutes. After that, by using this bottle brush, clean all the syringes. Rinse the syringes in the tap water. Keep the syringes for drying. Next step, you have to take the needles. The needles just put into the soap solution for 10 minutes. After that, after 10 minutes, take the needles, flush the needles to check the patency. If anything is blocked or blunt, check it. If it is blunt or blocked, we have to discard it and replace with the new needles. Wash this in running water. Keep it for drying. After drying the syringes, take the syringe bin. This also wash and dry. Clean the syringes and keep into the holes according to the size 10 ml, 5 ml and 2 ml. The needles also keep into the slot in the syringe bin. These needles we are using only to withdraw the injections from the vials, not to inject the patients. To inject the patients in our hospital, we are using only disposable needles. After keeping these syringes and needles, to close this syringe bin, open the holes of the syringe bin, keep the syringe bin to the autoclave machine. Syringe bin has to be kept in the autoclave machine in 120 degrees centigrade, 20 lb pressure for 30 minutes. After 30 minutes, the machine has to turn to fast exhaust mode for 15 minutes. After that, again it has to keep for 15 minutes vacuum dry. When the autoclave machine become cool, take out the syringe from the autoclave machine, close the holes which we opened before keeping inside, keep into the sterile area. Now the syringe bin is ready to issue into the wards. Thank you. Now the sterilization of gas syringes procedure is over. Let us summarize the procedure. The sterilization of syringes, steam under pressure. The articles required are: one plastic tub with a mixed solution of hypochlorite solution 1:6 dilution, stain remover solution and hydrogen peroxide. One plastic tub with hot water for washing the needles. One small size bottle brush, syringe bin with stand, syringes and needles, running water source, one pair of gloves and autoclave machine. The steps of for sterilization of syringes. First one, wear the gloves, receive the syringe bins, check the shortage and damage of syringes, remove the needles from bin and check for bluntness and blockage, discard if it is necessary. Check the syringes for its breakage or any damage. If so, get it signed in the breakage form. Keep all clean syringes in hypochlorite solution with soap solution and hydrogen peroxide. Then wash the syringes by using small bottle brush under running water. Flush and dry the syringes. Wash and dry the syringe bin. Keep all the syringes back into the bin after checking for leakage and cracks. Arrange the syringes in order 10 ml, 5 ml and 2 ml in separate row. Wash the needles with hot water and flush them and dry it. Place the checked needles in the slots of the syringe bin according to the size. Load the syringe bin to the autoclave machine with the side holes of the syringe bin opened. Autoclave them for 30 minutes under 120 degrees centigrade, 20 lb pressure. After 30 minutes, turn the machine to fast exhaust mode for 15 minutes. Then 15 minutes for vacuum dry. Close the side holes of the bins before placing them in the rack of the sterile room.